Let's discuss the 5 transporting points. LV8, QUQUAN, spring at the CROOK. Location with the knee flex. LV8 is located directly proximal to the medial end of the popliteal crease, in a depression anterior to the tendons of the semitendinosus and semimembranosus muscles. How to find LV8 is best located with the patient knee flexed and slightly external rotation of the hip. First, palpate the prominent tendon of the semitendinous muscle, which becomes more pronounced with the knee flexed. The tendon of the semimembranosus muscle lies deep to the semitendinosus and is often more difficult to isolate. With palpating finger, glide from the tendon of the semitendinosus towards the patella. Approximately after 1 tune, you can feel the depression between the muscle bellies. LV8 is located anterior to both tendons. Some authors locate LV8 1 tune superior and anterior to kidney 10. Sensitivity to pressure should determine the location. Kidney 10 is located approximately 1 tune in the direction of the popliteal crease and from a medial perspective posterior to the tendon of the semimembranosus and anterior to the tendon of semitendinosus. Needling vertically 0.5 to 1.5 tune. Actions indications clears and eliminates dampness and damp heat from the lower burner. Major action. Benefits the genitals and the uterus. Nourishes blood and yin, moves qi locally. Special features: Hosi point, water point, tonification point. LV8 benefits the bladder and genitals, resolves dampness from the lower burner in swelling and itching of the genitals, pain in the genitals, pain in the penis, impotence, difficult urination, retention of urine. Invigorates blood and regulates menstruation in abdominal masses in women, painful periods, amenorrhea, infertility from blood stasis, umbilical pain. It nourishes the liver blood. LV8's main function is to eliminate dampness, obstructing the lower burner for such symptoms as urinary retention, cloudy urine, burning urination, vaginal discharge, pruritus, vulvae. It is also effective for both damp heat and damp cold. LV8 also invigorates blood in the uterus and is used for painful periods and abdominal masses. Used with reinforcing method, it can also nourish liver blood. LV8 is the Hosi and water point of the liver channel. The Hosi points of the 3-leg yin channels, all water points were the common property of draining dampness and damp heat from the lower jiao. Kidney 10 predominantly clears damp heat from the urogenital system dominated by the kidneys, while spleen 9, by virtue of the intimate relationship between the spleen and dampness, is able to treat all dampness disorders of the lower jiao. Because of the close relationship between the liver channel and the genitals, LV8 primarily drains liver damp heat sinking down to this region. Liver damp heat may be due to the combination of liver stagnant heat and spleen dampness, invasion of the exterior damp heat, or excessive consumption of greasy food and alcohol. When damp heat pours into the liver channel, it may give rise to genital itching, swelling, and pain. If damp heat agitates the gate of essence, there may be seminal emission. The liver dominates the sinews, and according to the essential question, the genitals are the gathering place of the sinews. If damp heat sinks to the genital region, it can cause impotence due to flaccidity. In much the same way, the damp heat may cause atrophy disorder. LV8 is primarily indicated for these excess kinds of seminal emission and impotence, but in view of its secondary action of nourishing the liver, may be used in cases of deficiency. For example, the Great Compendium of Acupuncture and Moxibustion recommends LV8 for seminal emission associated with sexual taxation. LV8 is the water point, tonification point, Hosi point, antique point, antique autumn point, flexibility point. If there is excess water, the tree's roots can be loosened and thus becomes unstable. If there is insufficient water, the tree can become brittle, dried out, unable to yield. Similarly, the body mind can become brittle, dry, or inflexible. Can take one more trial or tribulation. This point can bring fluidity and flexibility back into a person's life. Consider for urinary troubles, retention, or excessive, or for many eye troubles, lack of secretions. Excellent for problems in the penis or vagina, especially discharges. For fear, sometimes worse than kidney fear. Anger, irritation, indecision, instability, jealousy, depression. Consider for a person who cannot tolerate change in their life. For troubles with the muscles, ligaments, and tendons, particularly around the knees. Thank you for your attention.
Now let's talk about the points of the eye system. Bladder 1, JINGMING. Bladder 1 is located 0.12 superior and medial to the inner canthus of the eye in a depression. How to find? Bladder 1 is located in a small depression near the inner canthus of the eye, superior to the insertion of the upper eyelid. Medially, it is bordered by the bony root of the nose. Bladder 2 is located directly above bladder 1 in a depression at the medial end of the eyebrow. Stomach 1 is located on the pupil line between the eyeball and the border of the infraorbital ridge. GB1 and TB23 are located on the outer canthus of the eye. Needling, ask the patient to look downward and outward with their eyes closed. Gently push the eyeball downward and outward from above. Needle perpendicularly along the supraorbital ridge in a posterior direction. Caution, angular artery and vein, eyeball periosteum. This point should only be needled by experienced practitioners. After removing the needle, press on the insertion site for 10 minutes. Despite this precaution, a bruise may still form. So inform the patient. No needle stimulation. Moxibustion is contraindicated. Alternative point is bladder 2 or transverse subcutaneous insertion at bladder 1 in the direction of bladder 2. Actions, indications, expels wind and clears heat, benefits the eyes. Special features, meeting point with the tumai, yin chao mai, yang chao mai, as well as the stomach, SI, GB channels, and according to some authors, also the TB channel. Entry point. Bladder 1 expels wind, lacrimation and exposure to wind, aversion to cold, fever, headache, clears heat, redness, swelling, and pain of the eyes, redness and itching of the inner corner of the eyes, stops itching, brightens the eyes for blurred vision, diminished night vision, myopia. Bladder 1 is obviously used mostly for eye diseases of both interior and exterior character. It can expel exterior wind and clear heat, which means that it can treat eye problems from wind heat, such as conjunctivitis and runny eyes. It can also clear interior heat and therefore help eye problems deriving from liver fire, such as red, painful, swollen, and dry eyes. It stops pain and itching of the eyes deriving from heat. Bladder 1 is a point where qi goes into the yin at night and comes out in the morning. This is connected to the circulation of the defensive qi, away qi, in the 24 hours, circulating in the 3 yang organs, greater yang, lesser yang, bright yang, in the day, and in the 5 yin organs, kidney, heart, lungs, liver, spleen at night. Therefore, this point is the function of a passage or gate between yin and yang, and as such, it is a dynamic point. Because of its role as a gate between yin and yang in the circadian circulation of defensive qi, this point can be used for either insomnia or somnolence. Bladder 1 can therefore be used in conjunction with the opening points of both the yin and yang stepping vessels, the yin chao mai and yang chao mai, for the treatment of insomnia. The yin stepping vessel transports yin qi to the eye, while the yang stepping vessel transports yang qi to the yin. If yang is in excess, the eyes will stay open and the person finds it difficult to fall asleep. In this case, One can reinforce kidney 6 to stimulate the yin stepping vessel, reduce bladder 62 to drain the yang stepping vessel, and needle bladder 1 with even method. The needling of bladder 1 closes the circle between the yin and yang stepping vessels and allows the balance of yin and yang qi in the eyes to be reestablished. For somnolence, reduce kidney 6, reinforce bladder 62, and use bladder 1 with even method. The regulation and exchange of yin and yang at this point takes place via the yin and yang stepping vessels, both of which converge at this point. As this point is the convergence of many yang channels, in fact, all of them except the large intestine channel. Similarly to Do14, it can be used to clear heat in a wide variety of eye diseases, such as red, swollen, and painful eyes, or to promote the rising of clear yang to the eyes to treat blurred vision. Bladder 1 is entry point, crossing point of bladders, SI, stomach, gallbladder, typal heater, Tumai, Yang Chao Mai, or heel vessel, and Yang Wei Mai, linking vessel. Helps to regulate secretions in the kingdom and thus influences the hormonal system. This is a powerful point for revitalizing the spirit, mind, and body. Can be used early on in treatment for water CFs. It is the start of the longest meridian in the body and the longest description of its workings in the spiritual organ, and connects deeply via the bakshu points to the outer officials. For all eye diseases, can help to improve eyesight. Consider for rhinitis and sinusitis. Ming, in its name, means radiance of the spirits, which shows in the eyes of the patient. Thank you for your attention.
Let's discuss the extra point, Yaoya, lumbar eyes EXB7, Yaoqi, miraculous lumbar point EXB9. Location 3.5 June lateral to the midline on the level of the lower border of the spinous process of the fourth lumbar vertebra, L4. How to find, locate the Tafier's line, and L4 EXB7 is located 3.5 June lateral to it. Located on the same level are Do3 on the midline, a point of EXB2, bladder 25, EXB6, 0.5, 1.5, 3 June lateral to the midline. Needling vertically 0.5 to 0.8 June. Actions indications, opens the channel locally, tonifies the kidney. Location note, the eyes referred to in the point name are the visible hollows found in many people just over 1 hand breadth either side of the lumbar spine below the level of the iliac crest. Needling perpendicular insertion 1 to 1.5 June. Action strengthens the kidney and benefits the lumbar region. Indication, kidney deficiency, lumbar pain consumption. Commentary, this point was first mentioned in Song to Keep Up Your Sleep. It is commonly selected as a local point for acute or chronic lumbar pain due to many etiology. Combinations, lumbar pain, 7 cones of moxa on Yaoyan, BW24 Song to Keep Up Your Sleep. Miraculous lumbar point, Yaoqi EXB9, location 2 June superior to the tip inferior end of the coccyx. How to find, locate the tip of the coccyx superior to the anus and palpate for the sacral hiatus. From there, palpate 2 June in a superior direction and locate EXB9 in a depression between the sacral processes. The one is located on the midline between the tip of the coccyx and the anus. Needling up to 1.5 June obliquely in a superior direction. Actions indications comes the Shen. Yaoqi location 2 June directly above the tip of the coccyx. Indications, epilepsy, headache, insomnia, constipation. Method, punctures subcutaneously upward 1 to 2 June 2 inches. Moxibustion is applicable. Okay. Thank you for your attention.
Now let's talk about GB38, Yang Fu, Yang Assistance at Jing River Point. GB38 is located fortune proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula. How to find? First, locate the prominence of the lateral malleolus, and from there, measure fortune in a proximal direction. There, locate GB38 on the anterior border of the fibula, or on the lateral aspect of the lower leg. The distance between the prominence of the lateral malleolus and the popliteal crease is 16 chung. Divide this distance into quarters and locate GB38, 1/4 of the distance from the lateral malleolus. 8. Spreading hands technique or elastic tape. For orientation, the borders of the fibula are deep to the peroneus brevis muscle and are often not easily palpable. For this reason, it is suggested to palpate the anterior border of the fibula just superior to the ankle and then locate the point on an imaginary line running to the head of the fibula. Needling vertically 0.5 to 1.5 chung. Actions, indications, opens the channel, clears wind and heat. Special features, Jing River Point, far point, sedation point. Subdues liver yang, headache, pain on the outer canthus of the eye, clears heat, bitter taste, sighing, hypochondrial pain, feeling of heat. GB38 is the fire and Jing River Point of the gallbladder channel, according to the Great Compendium of Acupuncture and Moxibustion. When the gallbladder is excess, reduce GB38. The main actions of GB38 are to clear stagnation and heat from the entire course of the gallbladder channel, clear Yaoyan heat, and benefit the sinews and bones of the whole body. In the head, GB38 is an important point for one-sided headache, principally due to liver qi stagnation or uprising of liver fire or liver yang, which transmit along the gallbladder channel. In the upper part of the chest, the gallbladder channel passes anterior to the axilla. When qi and phlegm stagnate, and in some cases transform into heat, usually due to emotional causes, there may be swelling and pain of the axilla or scrofula. In the chest and lateral costal region, GB38 is indicated when qi stagnates and gives rise to pain accompanied by sighing. In the lower body, GB38 is indicated for pain extending along the gallbladder channel on the lateral side of the lower limb and the lateral malleolus. If pain in any of these regions is severe, a blue-green Qing color may be seen on the complexion. This color, frequently observed around the mouth, eyes, nose, or temples, has traditionally been linked with liver disorders, severe pain, or cold in the body. According to both the spiritual pivot and the essential questions, Taiyang is the opening, Yangming is the closing, and Shaoyang is the pivot. The Shaoyang is the pivot between the interior and the exterior, and GB38 is indicated for the classic symptoms seen when a pathogenic factor lodges in this half interior, half exterior portion. These include distinct alternating phases of chills and fever, bitter taste in the mouth, pain of the chest and lateral costal region, and sighing. Malaria, for which this point is indicated, is a classic example of Shaoyang pattern. GB38 is fire point, sedation point, Jing River antique late summer point. This fire point brings sparkle to the wood. Consider where there are no plans for the future, where the patient cannot see clearly the way forward in their life. Useful when a person sighs a lot. This point supports our yang aspect for timidity, irritability, or where there is no sense of growth or development, for a bitter taste in the mouth. Consider for chronic migraine, often used with liver too. As a fire and sedation point on the gallbladder, this point clears liver gallbladder fire and subdues liver yang. This makes it a useful distal point for chronic migraine, irascibility, red eyes, bitter taste in the mouth, constipation, and gastric disturbances that involve heat. It can also be used when there is stagnation with headaches, oppressive feeling in the chest, and much sighing. As with all Jing River points, it can treat fevers, and particularly as the fire point on Shaoyang, gallbladder, and three heater in the 6 divisions of yin-yang, when a pathogen is stuck half interior and half exterior with alternate chills and fever, bitter taste in the mouth. Thank you for listening.
Let's discuss the heart channel luo connecting vessel system. Pathway, the heart luo connecting vessel separates from the heart primary channel at its luo connecting points, heart 5. It forms a three-dimensional reticulate network dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal divisions run to the interiorly exteriorly paired small intestine primary channel. According to some schools of thought, for example, they travel as a transverse heart luo connecting vessel to the U1 source point, SI4. The longitudinal division follows the pathway of the heart primary channel along the anteromedial aspect of the arm, ascends to the axilla, reaches the heart, ascends to the root of the tongue, and terminates in the eye, while further branches penetrates the brain. Clinical importance, pathology, in excess, distension and fullness of the thorax and diaphragm. In deficiency, in aphasia, disorders of the vocal cords. Points of the heart primary channel, specific points according to their functions. U1 source point, heart 7. Luo connecting point, heart 5. C-clef point, heart 6. Associated back shoe point, bladder 15. Associated front move point, Ren 14. 5 shoe transporting points, Jingwell point, heart 9. Ying spring point, fire, bend point, 5 paces, heart 8. Shoestring point, earth, sedation point, heart 7. Jing river point, metal, heart 4. Hussey point, water, heart 3. Hu meeting point, opening point, lower Hussey point, Ju meeting points, Gao command point, window of heaven point, points of the four seas, Madan Yang heavenly star point, heart 5, Sun Si Miao ghost point, other functional points. Points according to region, local point, elbow, heart 3, distal point, tongue, heart 5, heart 7, heart 5, heart 3. Specific points according to the channel pathway in numeric disorder. Heart 3, Hussey point, water, local point for the elbow, distal point for the heart. Heart 4, Jing river point, metal. Heart 5, Luo connecting point, Madan Yang heavenly star point, distal point for the tongue and heart. Heart 6, the C-clef point. Heart 7, U1 source point, distal point for the heart, shoestring point, earth, sedation point. Heart 8, Ying spring point, fire, bend point, 5 phases. Heart 9, Jingwell point, wood, tonification point. Thank you for your attention.
Now let's discuss the two heavenly star points of Madan Yang, liver 3 and bladder 60. Liver 3, Tai Chung, is located on the dorsum of the foot between the first and second metatarsal bones in the depression proximal to the metatarsophalangeal joints and the proximal angle between the two bones. How to find from the web between the first and second toes, palpate proximally past the metatarsophalangeal joints and along the groove between the first and second metatarsal bones until you reach the widest and deepest part of the groove. There, locate liver 3, which is often sensitive to pressure. To double check, when continuing to palpate along the groove, it will become more narrow and shallow again. Located in a similar position on the hand is LI4, between the first and second metacarpal bones. Needling vertically or slightly obliquely, 0.5 to 1 soon. Caution during pregnancy. Actions, indications of liver 3. Spreads liver qi, clears the head, benefits the eyes, nourishes liver blood and liver yin, calms spasms, alleviates pain, regulates menstruation and the lower burner, eliminates internal wind, pacifies liver yang. Special features, Yuan source point, shoestring point, earth point, Madan Yang heavenly star point, later added by Shu Feng, major point for spreading liver qi. Subdues liver yang for headache, dizziness, blurred vision, numbness of the head. Extinguishes anterior wind, opisthotonus, epilepsy, deviation of eye and mouth. Promotes the smooth flow of liver qi for hypochondrial distension, irritability, epigastric and abdominal distension, sighing, breast distension, nausea, constipation, borborygmi. Resolves dampness for hypogastric fullness, hernial and genitourinary disorders, swollen testicles, pain in genitalia, retracted testicles, swollen vulva, difficult urination, retention of urine, jaundice. Invigorates blood and regulates menstruation. For amenorrhea, irregular periods, painful periods, excessive menstrual bleeding, prolapse of uterus. Calms the mind, propensity to outbursts of anger, irritability, insomnia, worrying. Calms spasms, cramps, stiffness of the lower back with inability to bend, contracture of sinews. Liver 3 is the shoestring and yuan source point of the liver channel. The spiritual pivot in chapter 6 recommends the use of the shoestring points in disorders of the Zhang, while in chapter 1 it says when the 5 Zhang are diseased, select from the 12 yuan source points. Liver 3 is arguably the most important point of the liver channel with an extensive range of actions and may be used with equal effect for both excess and deficiency patterns of the liver, Zhang, and its channel. So important did the Ming Dynasty physician Xu Feng consider liver 3 to be that he added it to Madan Yang's 11 heavenly star points when listing them in his work Complete Collection of Acupuncture and Moxibustion. Since this time, these points have become known as Madan Yang's 12 heavenly star points. Source point, earth point, shoestring, antique summer point, total relaxation point, a Madan Yang heavenly star point, Shokantan point, independent point for spasms. This important and frequently used point is indicated for many conditions. It is particularly effective when sedated for a person who is tense, overexcited, easily angered or annoyed, agitation, or tightly wired. It brings calm and balance to the system. It can be combined with LI4 to accentuate the calming effect and help eliminate toxins on both the mental and physical levels. When tonified, it can bring a great surge of energy to the meridian. Its alternative name of happy calm describes its effect well. Consider for painful or irregular menstruation. Bladder 60, Kunlun, in the depression on the line connecting the Achilles tendon and the highest prominence of the lateral malleolus. How to find? Locate the highest prominence of the lateral malleolus. From there, palpate horizontally towards the Achilles tendon and locate bladder 60 in a depression anterior to the tendon. Needling vertically 0.5 to 1 tune. Caution, reducing needle techniques contraindicated during pregnancy. Exception, a supportive point during labor. If the patient is cold feet, the therapeutic effect can be increased by using a heat lamp or a hot cherry pit bag under the soles of the feet. Actions, indications, clears heat, subdues yang and wind, and eliminates excess, especially in the head, opens the channel, alleviates pain, relaxes the tendons, strengthens the lumbar region, promotes labor. Special features, Jing River Point, Fire Point, Madan Yang Heavenly Star Point, important distal point for the cervical, thoracic, and lumbar spine, especially for chronic cases. Clears heat for filling of heat in the head, redness, pain, and swelling of the eye, bursting eye pain, nosebleed, extinguishes interior wind and subdues rebellious chi from the head, epilepsy, lockjaw, headache, dizziness, removes obstructions from the channel, stiff neck, backache, upper backache, sciatica, strengthens the back for chronic lower backache, invigorates blood and promotes labor, difficult labor, retention of placenta. Madan Yang, the great physician of the Qin dynasty, listed bladder 60 as one of the 11 heavenly star points for cramping of the lumbar region and sacrum, inability to walk or even take a step. As soon as he moves, he groans. Bladder 60 is equally valuable in treating obstruction of the bladder channel in the lower limbs, especially in cases of sciatic pain radiating down the back of the leg, and is often combined with bladder 36 and bladder 40 in the chain and lock point association method. In the ankle region, Bladder 60 is an important point for pain and stiffness, and like several distal points of the bladder channel, it is able to treat pain of the heel. Fire Point, Jing River Antique Late Summer Point, a Madanyang Heavenly Star Point, first aid for facial neuralgia, fractures, sprains, ankle, and heel pain. For exceptional cold in the system, you can consider using moxa on this point along with KD2 to get warmth back into the water, but be careful not to overheat. Consider for foot or ankle pain, plantar fasciitis, or chronic back pain. Kunlun has a special effect on the whole of the spine. This is a useful spirit point, especially when a person can communicate, has no flow, is depressed or withdrawn. Helpful for violent headaches or if there is knotting in the calf muscle. The Kunlun Mountains are situated in the west of China, surrounded by a vermilion lake, hence the far point correlation, and are said to be the abode of the immortals and to renew the spirits. Thank you for your attention.
Let's discuss the Sun Si Miao Ghost Point, Stomach 6, Jia Chu Jaw Bone. Location with the teeth clenched on the highest prominence of the masseter muscle, approximately 1 finger width, with middle finger, anterior and superior to the angle of the jaw. How to find? Ask the patient to clench their teeth, which will allow the muscle belly of the masseter muscle to bulge. Stomach 6 is located on its prominence, a little anterior and superior to the angle of the jaw. With chewing movements of the jaw, biting and relaxing, the palpating finger will naturally fall into the right depression when the muscle is relaxed. Stomach 5 is located more medially in the depression at the anterior border of the masseter muscle. Needling insertion with the patient's mouth slightly opened, relaxed masseter muscle, vertically 0.3 to 0.5 tune or obliquely or transversely subcutaneously, 1 to 1.5 tune in the direction of stomach 4, stomach 5, stomach 7, for example, in cases of facial paralysis. Actions indications eliminates wind, benefits the jaw and teeth, opens the channel and Lu vessels, alleviates pain. Special features, Sun Si Miao Ghost Point, important local point for the jaw region. Its location corresponds to a commonly used trigger point on the masseter muscle. According to some authors, stomach 6 is a meeting point with the GB channel. Stomach 6 is a major local point to expel exterior wind affecting the face. Important local point for facial paralysis combined with LI4. Humps and spasm with the masseter muscle. Local point to extinguish internal wind in the face for facial paralysis following wind stroke, combined with LI4 for problems of the lower jaw, including toothache. This is another major local point to expel exterior wind affecting the face and is nearly always used as a local point in facial paralysis combined with LI4. It is also used for mumps and spasm of the masseter muscles. It is also a local point to extinguish internal wind in the face for facial paralysis following wind stroke. It is combined with LI4 for problems of the lower jaw, including toothache. Stomach 6 is one of the 13 ghost points listed under its alternative name, Ghost Bed, in the supplement to the 1,000 Ducat formulas by Sun Si Miao. This grouping of points was used to treat mania and epilepsy, and it is unclear why stomach 6 was ascribed this action, especially in the light of the fact that there are no indication of this kind listed for the point. One possible explanation is the fear that epileptics might bite off their tongue while gushing their teeth during a fit, in which case stomach 6 would be included in a prescription for epilepsy in order to relax the jaw. Ghost point. This point can be effective for Bell's palsy, trigeminal neuralgia, or neuralgia of the face, used as a local point for problems in the lower jaw, teeth, face, neck, or throat. It relaxes the sinews due to Yangming being rich in qi and blood. With the richness of Yangming available at this point, it helps the person be fully present. The act of eating in itself is grounding, and this accounts for it being one of the 13 ghost points. Expels exterior wind affecting the face. Local point for facial paralysis, swelling, neuralgia. Local point for problems of the lower jaw, including toothache, locked jaw. For problems affecting the teeth, face, neck, and throat, sore throat, voice loss, usually combined with LI4. Local point for mumps, spasm of the masseter muscles. Thank you for your attention.
Now let's talk about blood deficiency pattern for constipation. Clinical manifestations: dry stools, difficulty of defecation, dull pale complexion, dizziness, numbness of the limbs, blurred vision. Tongue pale or normal, pulse choppy. Treatment principle: nourish blood, moisten the intestines. Points: stomach 36, spleen 6, Ren 4, spleen 15, bladder 23, bladder 20, bladder 25. Reinforcing method: stomach 36 and spleen 6 nourish blood. Stomach 36 also promotes the bowel movement. Ren 4 nourishes blood. Spleen 15 promotes bowel movement. Bladder 23 and bladder 20 nourish blood. Bladder 25, back shoe of the large intestine, promotes the bowel movement in chronic constipation. Case history: we have a 39-year-old woman suffering from constipation for 20 years. She had only 2 bowel movements a week, but her stools were not particularly dry or small. Her periods were rather scanty, and she suffered from premenstrual tension. Her memory was poor, her tongue was pale and partially peeled, and her pulse was generally choppy. So here is the tongue of the 39-year-old woman suffering from constipation, which actually indicates severe blood deficiency. This is a clear example of constipation from blood deficiency. This is apparent from the pale tongue, choppy pulse, poor memory, and the scanty periods. A pale and peeled tongue, often referred to as chicken flesh tongue, that is looking like uncooked chicken, indicates severe blood deficiency. There is also some stagnation of liver qi originating from liver blood deficiency. Treatment principle: nourish liver blood, moisten the intestines. This patient was treated with herbs. Thank you very much for your time.